Are you getting ready to have a consultation with your explant surgeon? Or maybe you're just curious about what to expect and what you need to know about explanting and explant surgery. This video will cover everything. Before we get into it, I want to mention a couple things. I'm going to timestamp everything that I mention in this video for you. You can find it down in the description area, and that way if you want to go back and find just something really specific, like anything having to do with the MTHFR Gene-Mutation or drains or the breast lift or whatever you're specifically looking for, you can just go down below and it'll take you right to that area where I talked about it. And be sure that you watch all the way till the end, because I'm going to be sharing a few resources that I created for you to make this process so much easier, such as this guide, this checklist, along with all of these that are in my BII BRIDGE program. And if we've never met before, or if you're new to the channel, hello, my name is Christina. I'm the founder of Size Happy and the admin of the Facebook group Breast Implant Illness Rejuvenation and Education with Christina. And you can also find me on Instagram at I am Size Happy. All right, let's get right into it. First things first, and let's start off where you will most likely start off, and that is with finding an explant surgeon. There are some lists that are circulating amongst groups and online about recommended expert explant surgeons. When you see a surgeon on that list, I feel like this goes without saying, but I feel like I need to say it. You got to do your own I always have a hard time saying this word. Due diligence when it comes to picking out your explant surgeon. Some things that I would look into is I would go online, look for reviews, and I would also go inside Facebook groups and make a post and ask the question, has anybody ever used so-and-so surgeon from so-and-so country, state? And what was your experience with him or her? Do you recommend them? Stuff like that. So first things first is you're going to want to find a good explant surgeon. And with that, you got to really do your due diligence. After you find your perfect explant surgeon, when you go to your consultation, you'll want to bring with you some consultation questions. And what I mentioned in the intro of this video is this guide, Discovering Breast Implant Illness, What Now? This guide has all of the consultation questions in it that you'll want to bring to your consultation. So I recommend downloading this guide, printing it out, and bringing it with you to your explant surgery consultation. And you'll want to make sure that your explant surgeon will do your explant en bloc. And so what is en bloc? And we hear these terms en bloc and total capsulectomy. So en bloc just means together in one piece. So when your explant surgeon does your explant, they're going to take the implant and that capsule, the red scar tissue, the capsule that you see in like all these photos and the videos, they're going to take that out together in one piece. He or she is not going to, cut through the capsule and then take your implant out and then go back in and remove the capsule and all of that. And the reason why you want to be sure that your explant surgeon will do your explant en bloc is because if your breast implant is ruptured, or if your saline breast implant has mold in it or fungus, which does happen, you want to make sure that it's done en bloc so that everything that's inside that capsule and that breast implant is all in there, taken out at one time. Because if you cut open the capsule, you could expose your body to all those chemicals and those heavy metals that the breast implants are made up of if it is ruptured. And then you'll also want to make sure that he or she will do something called a total capsulectomy. And so what this is after they take out your implant and the capsule en bloc, they'll go back in and they'll remove any kind of capsule that might be stuck to your ribs or your tissues or your muscles, and they'll either peel it off or scrape it off or cauterize it off. But you really just want to be left with a clean chest cavity after your explant. If you stumble upon an explant surgeon and they say like, doing it en bloc is not necessary, or I don't think we need to do it en bloc, I'm just going to, take your implant out, or maybe I'll leave your capsule in. I mean, we definitely don't suggest you going through with that. You want to make sure that that capsule is also taken out, because it could, and most likely does, harbor some of those chemicals and those heavy metals that were bleeding off of your implant. So when you do your explant surgery, you want to make sure that your explant surgeon is really comfortable with and is like, yeah, we're going to do this on block. If they won't do it or don't do it, don't offer it, I would personally suggest finding a different explant surgeon, because every explant surgeon that I know of that deals with women who have breast implant illness know that capsule needs to come out during your explant surgery. If you have saline breast implants, it's pretty common for a surgeon to say, like, let's drain your saline first, and then in a couple of weeks, we'll come back in and we'll do the surgery. Again, that's not really recommended when it comes to doing an explant surgery. Everything should just be done at one time, removing the implant and the capsule together in one piece. And a couple videos back, I did talk about saline breast implants specifically. And just to kind of recap, a lot of saline breast implants can have mold, bacteria, and fungus floating around in them. So you don't want the water inside of there drained, especially inside of you, because all of those things, of course, will get inside of your body, get inside of your bloodstream, and just cause a plethora of other issues. So the golden standard when it comes to explant surgery is to get everything done together in one piece. I just can't emphasize that enough. And muscle repair isn't always necessary. I had my breast implants underneath my muscle, and you might think like I would have a tear or something like that, but I didn't. I didn't need any kind of muscle repair. But when you do go to your explant surgery consultation, just see if he or she will do muscle repair if you do need it, and if there's an extra cost. Usually there shouldn't be an extra cost, but just to get some clarity on, whether or not he or she will do that during your explant. Something else that you'll want to see if your explant surgeon offers is something called Nerve Bloc. And what it is this kind of like numbing agent, so to say, that they inject in you during your surgery. And it just really helps to alleviate any kind of pain that you may experience right after your surgery. It is said to last up to 3 days. So I did have the Nerve Bloc, and the only thing that I ever needed to take, and I think I took it for like 3, maybe 4 days, was extra strength Tylenol. Nerve Bloc does cost anywhere from $350 to $500 extra, but it is definitely worth looking into if you do have a low pain tolerance. So now let's get into breast lifts and whether or not you need one. And I personally feel like I can't really give a recommendation on this. I feel like it's something that you need to decide on for yourself. And I feel like your plastic surgeon would probably know best whether or not, you would even benefit from a breast lift. Some requirements of a breast lift, and I have some notes right here, is how much breast tissue you have, your skin quality, and what the position of your nipple is. And I have some visuals here of where your incision would be depending on what kind of breast lift you have. All right, so if you get a horizontal lift, your incisions will be right underneath your breasts. If you get something called a crescent lift, it'll be right around the top of your areola. If you get something called a donut lift, basically you'll get cut right around the entire part of your areola. And then a lollipop lift goes up your breast and around your areola. And then there's something called an anchor lift, which goes under your breast, up your breast, and around your areola. Now, when it comes to fat transfers, some explant surgeons won't do a fat transfer at the same time that they're doing your explant surgery. The reason why is because it is very traumatic on the body. You're essentially getting liposuction at the same time as your explant surgery, and your explant surgery itself is a very traumatic and it's very harsh on the body. When you do get a fat transfer, they say that only about 30% of your fat actually survives. The other 70%, I don't know what happens to it. I don't know if your body just kind of absorbs it or whatever. But a lot of surgeons will have you wait anywhere from 8 months to a year after your explant just to kind of see how things heal and things settle before they'll do a fat transfer. Let's get into the dreaded drains. Some explant surgeons use drains, and some, I guess, think that they're useless. From what I understand, drains are there to help you collect fluid from the area and obviously drain it out of your body to reduce swelling. I had drains, and most women, I would say 50% have drains, 50% don't. Again, I don't know if it's a bad thing, if it's a good thing. Every surgeon's kind of like a little bit different in their post-op care. The average time that women have their drains in is anywhere from like 3 days up to 2 weeks. And again, it really just depends on how much fluid your body is draining. So if you're draining, I believe it's like 20 cc's, and you're draining like less than that for about 2 to 3 days straight, then your explant surgeon will most likely feel comfortable with taking those drains out. If you suspect that you have BIA-ALCL, or if you just kind of want to have that peace of mind of knowing that you don't have it, the pathology test that you'll want to make sure that your explant surgeon does during your explant surgery is called the CD30 test. Your explant surgeon should be pretty familiar with this test, but you'll want to make sure that they do that test. Some of the symptoms of BIA-ALCL are swelling or asymmetry, like one breast all of a sudden is a lot larger than the other, redness, pain, or if you have any lumps in your breasts or in your armpit. Some more rare symptoms of BIA-ALCL include rash, hardening, fatigue, and weight loss. So if you're experiencing any of those symptoms, I would definitely, just for peace of mind, recommend getting the CD30 test. It obviously will cost you a little bit extra money, but having that peace of mind there's nothing better. During your explant surgery, you are going to go under and you are going to get anesthesia. So if you have the MTHFR gene mutation, your body will use up a lot more B12 during that procedure. So you'll want to make sure that after your procedure, you're just really up and up on getting B12, and you could do that either through supplementation or through shots. You can find more information about this specifically on the website called breastimplantillness.com. After your explant surgery, you should be wearing a nice compression bra, or maybe something like some saran wrap and a compression bra, just to keep everything, one, in place, and two, to help just reducing swelling. Your explant surgeon will probably tell you this, but when you go to your explant surgery, you want to make sure that you're either wearing a buttoned up shirt or a zipper shirt, and then some really comfy pants. I wore some unicorn puffy pajama pants and some socks just because I get cold feet. All right, so what about the cost? So the cost of an explant by itself, doing it en bloc with a total capsulectomy, can range anywhere from $8,000 to $14,000, just depending on the surgeon, depending on the location, probably depending on like how popular they are. And of course the price will change if you get nerve block, if you get a lift, if you get fat transfer, which should be like the only 3 other expenses included. Something that I used was Care Credit. I know a lot of other women use Care Credit, and I forget what it was, but I got like $4,000 and I had no interest for like 2 years. So Care Credit is a really good option if you obviously don't have that much money laying around, which who does? Depending on which insurance company you have and just how it's worded and everything, some ladies have been able to get their explant covered through insurance. I myself am not very familiar with that just because I don't have health insurance, or I didn't at the time. So, in regards to this, I would definitely make a post inside any group and just ask, like, did any of you get your explant covered by insurance, and like, how did that work out and stuff like that? Or you can go to the search bar inside of any group and just type in insurance, and anybody who's ever made a post about insurance, it'll pop up for you so that you can go through there, read the posts, and then also read the comments that are underneath. You can expect your explant surgery to be anywhere from 2.5 hours to 4 hours, depending on, of course, whether you get a fat transfer, a lift, if there's any kind of complications, anything like that. In this video, I really just wanted to dive into the actual surgery and not so much like the preparation part or the recovery part. But if you are looking for more information in regards to those 2 things, I have so many videos on this channel that will go over how to prepare for or how to recover from your explant surgery. 15 videos below this one is what to expect after explant surgery. 13 videos below this one is what to avoid after explant surgery. And just one video below this video is how to heal faster after explant surgery. If you're looking to go into your explant surgery in style and make a statement, I have these really cute size happy drawstring bags. Very lightweight, very small, and you can stick things in here like your water bottle on the way home, your breast implants that they'll hopefully give you back, some deodorant, some sunglasses, a hairbrush, little shades for driving home. It's nice and tiny, and it'll fit everything that you need. And when you walk in, you're going to make the statement that I'm finally size happy. And I'll be sure to link the guide and the checklist and to my 12-week healing and detox program, the BII Bridge, where you're gonna get all this amazing stuff along with videos down below in the description area. And two things before you go, if you could comment down below and just share with us your explant surgeon and where he or she is located and whether or not you would recommend him or her, that would really help everybody who's watching this video. And also, if you would be so kind as to share this video inside your favorite Facebook group, that is like the best way that you can support me in my work, because a lot of what I do is for free. And that wraps up this video. I'll see you on the next one. Bye.